You can tell it's Friday here at KFWB News Talk 980. You're listening to As We See It with Phil Hewlett and friends. I'm Phil Hewlett. Jennifer Bjorklund is here. So are Jay Capadonia and Chris Martin. And not too long ago, I think it made headlines when Dr. Sanjay Gupta came out all of a sudden after being staunchly against medical marijuana, changed his tune and said he was in favor. And a local doctor has done the same. And I think it's a compelling story that you need to hear now about why he changed his mind. Joining us live now is Dr. Thomas Minahan. He's board certified in emergency medicine, has been practicing for over 15 years, and he's the founder of Mallory'sHope.org. We'll find out more about that in a moment. Dr. Thomas Minahan joins us live now. And Dr. Minahan, thanks again for coming on the program. You've been a proponent of this sort of thing for some time, haven't you?
I appreciate the time.
Yeah, happy to have you on here. First, give us your professional opinion.
Well, put me back 8 months ago, and if you use marijuana, you were in the class with the heroin abusers and everybody else that I've seen forever and abuse drugs and just make our ERs busier and busier.
So you thought, okay, using marijuana as a treatment for pain or something else like that is like going to the dark side. Is that,
well,
is that your position?
I see a lot of people come in with, they have the back pain and they're on the marijuana. And I know of people who have gone and got their card just so they can legally get high. It's abused extensively, and that was my attitude. And I'd see a ton of people in the ER say they were using it medicinally, but I didn't believe it.
It's not unusual these days, since there was a very public 180 on this. Dr. Sanjay Gupta came out nationally on television, who was always against medicinal marijuana, and then he changed his mind on this as well. So are you finding more of your colleagues coming to the conclusion that maybe this is a reasonable treatment for certain incidences?
For certain things, absolutely. And people who know me and know my history and what I've been through for 10 years, or should I say more what my daughter's been through for 10 years, they know there is something here. There's definitely something here.
I want to ask you about your daughter then. That's the personal experience that led you to this opinion. Tell us about that. What was she suffering?
So she has intractable epilepsy. She seizes about 30 to 40 times a month. There are some nights she sees as many times as 12 times in a night.
So, describe a seizure.
You'll lay in bed next to her, and she starts to roll, but it's not a purposeful roll, and then all of a sudden the shaking starts. You hear this screaming out, and then she pees the bed. It lasts about a minute. Sometimes she looks blue in the face, and as an ER doctor, it scares you.
Yeah, and ultimately it scares her as well. Is she in danger of hurting herself severely?
The incidence of death of an epileptic is 20 times the average person. I pulled her off the bottom of a swimming pool about a year ago after a seizure at a swimming lesson.
My goodness.
We've had our go around.
How old a girl is she?
She's 11. She's had them since she was 14 months, and we've tried everything. When I say everything, I mean everything. The list of meds we've been through. I am fortunate to have the ability to have access by my income and by my, the people that I know, to the best doctors in the world. What's the average person do?
Exactly right. And so that's when marijuana comes in, because at least for the time being, the prices are reasonable. And but before we get into your transition with your daughter to treatment with marijuana, describe for me some of the pros and cons if you were to compare whatever downside there is to treating a patient with marijuana to the potential downside of some of the best pharmaceuticals that are out there for this particular condition.
Well, we know some pharmaceuticals make kids cognitively slower, so they're going to end up in school behind the other kid because they were on a medication. We know that exists, and yet we're okay with that as physicians because we have studies that say this is what happens, this is a problem, and we're okay with that. I think a lot of the naysayers about the medical marijuana are we don't know what it does to kids, and there aren't a lot of studies out there. But I got to come back and go, well, how about the next 1,000 seizures? What's that going to cause if we don't do something to stop them, or the meds over the next 5 years that we know cause problems?
So you know what it does to your kid, and why don't you get into that now and describe the process? She's not smoking, I don't believe. Is she probably in pill form, right?
Fascinating. I had a physician who I respect, who I think is very knowledgeable, last week asked me, does your daughter smoke? I mean, is that, and I think that's some of the question in the medical community. They just don't know.
That is difficult to believe that a man that in that profession will actually ask if your 11-year-old child is lighting up. That's really funny.
When I started chasing this, I wondered myself, how do you get this in a kid? So it comes as an oil, and it's phenomenal. It's easy. We gave it to her, and her seizures went down by 2/3.
Wow.
2/3. And she was, we had a tutor come into the house because she's been slow. She's back in regular school.
And she's competing with the other kids on the same level.
She's behind, and she's been behind. She's had so many seizures over the years. She's behind.
Right.
But people will tell you who haven't seen her, like they see her once a month or so, and they'll say, "What a change! What are you doing?" If they don't know what we're doing.
You're experimenting with this essentially, aren't you? I mean, do you actually know the appropriate dosing?
My kid is a guinea pig, but I have no choice, and I had no choice when we came to this. I am experimenting. I have learned more on Facebook, sadly, than I have in any textbook or any journal about this. My kid's not getting high. So for all those people who think, you get your kid high, there is THC in my kid's system, but so over the years, THC is what's going to sell in the dispensary, high THC, because that's what gets you high. So the second compound there is called CBD, stands for cannabidiol. That's the second most common. So over the years, that's been grown with more THC and less CBD. So there's a strain that's exact opposite. So high CBD and low THC. And that is what she's on.
The governor of Tennessee, Bill Haslam, is actually fighting to get it legalized just specifically for helping children with your daughter's condition. And I think the House Appropriations or somebody over there and some politician voted it down. And the governor came out the other day and says, look, I can see there's actual results of these CBDs, and I am going to fight and do everything I can to help these kids.
That's awesome.
Yeah, I thought it was amazing, and your story is amazing.
So a friend of mine helped me put together a clip of where I was and where I am, and I've shared it with the doctors that I know. One sent it to a Maryland representative who completely changed her tune. I mean, she was in the same boat with me about, come on, marijuana, please.
Yeah, this is a video that we could find online?
Yeah, at Mallory's Hope. MALLORYSHOPE.org.
.org.
A video plays of kind of where we were and my thoughts and who I am and where this girl has become.
We'll link to that on our site. Are you prescribing this to your patients when you see them?
I'm an ER doctor. I don't do any continuity. I don't see people long term. I've suggested it to people if they say they have seizures and then they don't work. The meds they're taking are not working. I've suggested it as an option. I've yet to write a card yet. Dr.
Thomas Minahan, I hope your daughter continues her recovery with her seizures and in life. And we're going to hear from you again. It sounds like you've become a lifelong advocate now.
Oh, yeah, absolutely.
All right. Well,
yeah. Thank you for your time.
All right. That was something, guys. I don't know where you all stand on it now, but I think more and more this is becoming the popular opinion.
It really is. It's such a moving story when you put a face on it, especially of a child that has to go through something like that.
And there's no reason to stigmatize certain drugs. Drugs are drugs.
Agreed.
If they work for something, I'm on board too.
Right. Okay. And the thing is, the pharmaceuticals that were available out there were bad for her.
Right. And I believe Wisconsin just approved the use of CBDs for children yesterday.
Very good to know.